So, I'm talking to you about trachoma, and I'm going to just do a few brief slides for those of you who are not familiar with trachoma. So, trachoma is an infectious eye disease caused by the bacteria Chlamydia trachomatis. The inflammation we find mostly in young children, age 6 months to 5, 7, 8 years of age. This inflammation over time and repeated infection leads to scarring of the upper tarsus. So if you evert your eyelid, you can see scarring. What that scarring does is that scarring then leads to trichiasis, which is where the lid rolls in. Basically, this is where lashes are rubbing the front of the eye. This, as you might imagine, leads to blindness in many people. This condition, trichiasis, affects women about twice as frequently as it affects men. So this disease is very much what we call a gendered influence disease. Blindness due to trachoma comes from the corneal opacity that results from the scarring. So what do we do about trachoma? We have globally what we call the SAFE strategy. The S stands for surgery, A for the antibiotics, facial cleanliness, and environmental improvements round out the top 4. The surgery is really to correct the intern eyelid. This can be done in the village. It doesn't have to be done in a hospital. It can be done by a well-trained ophthalmic clinical officer. It does not need to be done by an ophthalmologist. The antibiotics are treated on a community-wide basis. We think of mass drug administration in terms of the antibiotic. And as Chris mentioned earlier, azithromycin is the drug of choice, the same as for yaws. But we don't treat individuals, we treat populations. The last two part, facial cleanliness, reduces transmission, and the environmental improvements also reduce transmission. Those last two, I'm glad to hear KOICA's interest in those last two, because those two components, the F and the E, are those two that have been the very weakest within trachoma control. We can throw a lot of antibiotic around the world. It will not make a difference unless we have good face washing and environmental improvement approaches. So what's the situation with trachoma? Well, that map makes it look like it's everywhere, most everywhere. That makes it look like Sydney, Australia has trachoma. This map is somewhat deceiving because it's just where trachoma exists in a country. It may just be a small pocket. It's a bit more useful to look at trachoma from the terms of looking at specific maps that shows endemicity in areas. And we look at trachoma in two ways. We look at trachoma from the point of active trachoma, which is that infection we saw earlier. And right now, the estimates are that we have 232 million people living in trachoma endemic areas and that need antibiotic and facial cleanliness and environmental improvements. But right now, the current estimates are that only about 52 million people are actually in areas receiving aspects of the AF&E part of the program. So that leaves us a gap of probably about 180 million people globally. And I put down a few priority areas because in terms of the global burden, these 3 countries account for probably about 60% of the global burden. And those are the areas where concentrated efforts are truly needed. When it comes to trichiasis, the intern lashes, estimates are about 7.3 million people globally have trichiasis. Between 2011 and 14, only 162,000 surgeries were done on an annual basis, which means if we keep at that same level of productivity, it's going to take us 41 years before we manage the current backlog. And trachoma is a disease which the global community has dedicated elimination by the year 2020. We will not achieve our elimination target at that level of productivity. So what are the major initiatives that are underway to address it? And I have to say, I've worked with trachoma for 25, almost 30 years, and the last 5 years of trachoma has been the most exciting. In fact, the last 2 years have been truly the most exciting, and a lot of it is because of the initiatives that I'm just going to walk through here. The first is what WHO has done. There's been a huge change at WHO in terms of its engagement in trachoma. WHO now is taking the lead. It is leading in terms of providing guidance to countries for elimination, for surveillance, for intervention. And this has been extremely useful and has made huge gains for us over the last couple of years. The second is what we call the Global Trachoma Mapping Project. This is funding that came from the British government, from DFID, that has allowed for mapping finally all the rest of the areas of the world that needed mapping. This has gone extremely well. We've achieved more than what we anticipated. So up till now, over 2 million people have been part of the surveys. It's covered 25 countries. We have probably 5 more yet to do. But by the end of this year, this project should be finished, and we should have mapping completed globally, except for a few places, Yemen, South Sudan, whatnot. But this has been a tremendous improvement because now we have much better roadmap of where we need to treat and why. The third item has been the engagement of the donor community. And last year, a little over a year ago, the British government and the Queen Elizabeth Diamond Jubilee Trust decided to make a major commitment for trachoma control. And this is covering 6 countries. It does say South Sudan and the Central African Republic here, which we've not started yet because of insecurities. But these countries are targeted either for elimination or to make a substantial progress. And they are underway now, and they are quite significant programs, but I don't want you to think that every country on the list is now taken care of. Ethiopia, the program in Ethiopia only covers certain zones of certain regions. Huge areas of Ethiopia remain uncovered right now. The next is USAID, and KOICA has had a long relationship with USAID, and USAID has also made a significant contribution for trachoma. They have also supported a lot of mapping, and they're also now supporting a lot of development of what we call dossier development, meaning then countries that are near to elimination, creating a dossier to allow them to make an application to WHO for elimination. More recently, in fact last year, USAID started to make a contribution for trichiasis, and that is a major project that is underway in Ethiopia, Burkina Faso, and Cameroon. All of the work by DFID and USAID has been done in coordination. There is no overlap, which has been absolutely fantastic from a standpoint of not wasting any money. If DFID has said that they are going to support surgeries in a place, then USAID says fine, and we will support the antibiotics and some face washing and environment. So they have worked very closely together. However, and as you'll note the major note at the bottom, there is a need for new donors. The US and the UK have a successful partnership, but we're hoping that KOICA and the Korean government also become part of that partnership down the line. The last is what we call the International Coalition for Trachoma Control. This is the group that comprises all of the NGOs and the academic institutions globally. And their role, as you might imagine, is advocacy, but it also includes a lot of work within the countries to support the ministries of health. So they're often the ones supporting ministry in the implementation of it. The other thing that ICTC does is to promote the use of preferred practice materials across all NGOs and all countries. It has quite a huge group that are involved, and I do want to point out there are two organizations here in Korea, if I do this properly. I'm not sure, pointer. Heart to Heart Foundation, who is here in the room, and our colleagues from Yonsei. And so this global group includes colleagues from Korea, and this partnership is incredibly important to all of us because it means that we're all working in the same way, in the same guidance, in the same fashion. And so we don't end up with duplication or mixed messages. My last slide is really a statement that we can eliminate trachoma. That goal of eliminating trachoma by 2020 is possible. We have the strategy, and that strategy is evidence-based. So we know what to do, and we know how to do it, and the evidence is there to back it up. The global mapping is almost finished, so that means we know where to go and where not to go, where not to waste our money. We also now have preferred practices for all aspects of the SAFE strategy that helps countries in its mass drug administration, in their trichiasis surgery, and now, of course, for WASH. We also have the partners and the governments on board to support elimination as we move forward. And that national capacity is growing. In every country now, local capacity that leads to elimination is growing extremely well, and it is very strong in many places. And finally, I would like to see Korea become a major contributor to elimination, and that is my hope from our meetings today. Thank you.